So while we're waiting for Jessica to get back on, I saw your lips moving, Jessica, but we still can't hear you. So while we're waiting for Jessica to rejoin and get her audio back, why don't we go ahead and do some introductions from the folks from Care Synergy. So my name's John Bloschke. I'm the CIO for Care Synergy. I've been here for about 8 years, and I've been in the healthcare industry for almost 25 years in the IT world. So I have responsibility for everything from computers to all the applications, including Blink, that we support. So Evan, you want to go next?
Absolutely. Thanks, John. Good morning, everyone. My name is Evan Hyatt, and I'm the Vice President of Marketing and Communications and Development for Care Synergy. And I've been with the organization about 3.5 years, and prior to that, as with one of the affiliates under Care Synergy for a number of years. And so my role as the communications leader was to work closely with IT to first implement Blink and then to develop ways with others on the team, and you'll hear from Carrie here next, of how to build on the utilization of it. Carrie, would you want to go?
Good morning, everyone. Thank you for joining this morning or afternoon or evening, depending on where you are in the world. My name is Carrie Davis. I'm the Care Synergy Director of Education. I've worked in hospice and home health care with Care Synergy and our local affiliates for about 11 years. I've worked in hospice and home health field for 15 years, was previously with another organization. And I'm responsible for orienting and training all of our 700 plus team members that work with our organization. We typically do orientation every 2 weeks in our company, hiring about an average class size of 15 to 20 every 2 weeks. So it's very exciting. I'm very excited to be here with you and share our experiences that we've had internally at Care Synergy and with our team members about Blink.
And Jessica, were you able to get?
Can you hear me now?
We can now hear you.
Oh, thank goodness, guys. Okay. We'll pass on to our next introduction, which is, I'll start with myself. Sorry about the technical difficulties. I'm Jessica McDonald, a solution consultant with Blink. I will be hopefully hosting the rest of the webinar for you guys today. And for those of you who are not very familiar with Blink or maybe new joining us today, a quick introduction on Blink itself. So Blink is the super app that allows you to give instant access and connection to everyone and everything that your workers need with a click of a button. And we do this first by starting with enablement. Blink will serve as that digital front door, giving workers simplified, frictionless access to all of the systems and information that they need day to day. And then we layer on top of that engagement, providing a very familiar space for people to get communications of all different types and levels in one simplified, structured place, which reduces the noise and increases the relevancy. And finally, we help organizations understand their workers by gathering insights and metrics on the back end so they can see where things are working well and their workers are thriving, and then also target potential areas of improvement or dissatisfaction so they can then take measures to address them. And in doing this, Blink is able to create a workspace where your workers feel engaged and they feel empowered in their roles. And with over 300 happy customers, as you can say here, organizations are achieving results like reduction in turnover and increased employee satisfaction. And this is all being fostered by the connection that Blink is providing those workers. So I think we got through. John, did we do an introduction of yourself?
We did.
And Carrie and Evan as well? All right. So let's get started then on the fun part, why we're here for our discussion today. So I want to start with you, John, if that's all right, talking a little bit about the home health industry and a little bit about the healthcare industry in general, and about why you think culture is critical in home health today.
Sure. So let's take them in the reverse order, right? Healthcare. I've been in healthcare for 23 years, and Jessica just did a great job of talking a little bit about the connection that Blink brings to employees. The flip side of that coin, however, is, in the healthcare industry in general, culture is critical primarily because we are walking into an environment, whether it's a hospital, whether it's a home health agency, where most of the time our customers don't really have a full picture of what's going on. We are the subject matter experts, and we are recommending a course of treatment. We are recommending a set of sort of activities that the client then needs to follow, or the patient then needs to follow. And if you don't understand sort of what you are buying, the way in which that is presented is critical, right? So if my doctor's telling me something, and I don't really understand what I'm being asked to do, but I trust the doctor, or I trust the physical therapist or RN, that's really that level of trust that's going to allow me to take that word, take that information that's being provided to me, and maintain compliance. So that ability to create trust between a caregiver and the person receiving care is critical for the success of the healthcare organization. In home health, hospice, and palliative care, it's even more critical, right? Because instead of a patient coming to us and seeing all of the brilliant facilities we have, et cetera, most of our services are being provided in the home. And so our ability to sort of create a culture that is welcoming to our patients and is welcoming to the services they are gracing us and allowing us to provide to them, sort of makes that relationship. And we didn't really go into who Care Synergy is, but Care Synergy, as Carrie said, is about 700 employees. We're made up of 4 organizations up and down the Front Range of Colorado, from Colorado Springs all the way up to Fort Collins. And so because we are so disparate in our locations, we can't dictate culture, and it's not easily learned. These are folks that are out in the field, and they might spend 3 days in orientation getting to know sort of how we do things, but that culture that we would like to have at any of our 4 affiliates, and that Care Synergy as a whole, doesn't flow naturally because you have spent 3 months in the office and learned that it's okay to do X and it's not okay to say Y. It really has to be focused and directed and learned rather than just sort of gleaned through osmosis.
Yeah, thank you for that, John. Let's talk a little bit about life before Blink and what the employee culture and engagement was like before you implemented Blink.
So I would say our culture was fractured or inconsistent. So if you walked into an office or you met with an employee of affiliate A versus affiliate B, you weren't getting the same messages, and the culture was a little bit different. And remember, variance is okay in an employee culture as long as it is sort of variance by design rather than variance by default. And what we had was a variance by default. We heard, and we were struggling with cascading information. So we grew inorganically, meaning we had folks joining our affiliation, and all of a sudden they had the Care Synergy label on them, and they were supposed to understand the Care Synergy culture. And what we heard from our folks over and over and over again was that communication about what it means. Why did we become part of Care Synergy? What does it mean to be a Care Synergy employee versus a Pathways Hospice employee or a Pikes Peak Hospice employee? Wasn't getting communicated effectively. And for those organizations that were already in the affiliation, they didn't understand what it meant to bring on a new affiliate and what it meant. We went from 500 employees to 700 employees. Who are these 200 new employees and where do they come from? So before Blink, overall, I would say it was a culture that was inconsistent and fractured.
Okay, thank you, John. Evan, I'm going to pass to you now. Tell me a little bit about just how you got started with Blink. Where and why you began your search. What were the specific pain points that you were looking to address, and how Blink fit into that?
Sure, Jessica, thanks. So to build on what John was saying about culture, because it obviously starts there, those were the pain points. Things were fractured. We did not have within the organization a centralized way or place to communicate with employees. We relied very heavily on email, mass email. Each organization kind of did their own thing. Some of them, one or two, I think, had their own intranet capabilities, which allowed for, I would say, a limited way of communicating internally. But some of those were outdated and not well kept up. So our search kind of started from those pain points of not really having a good way to communicate with folks. And so I started in the latter part of 2019 in this role, and we knew it was something we wanted to do and would get to it. And then everybody knows what happens in March of 2020. And it only highlighted the fact that we did not have a way to communicate across the entire organization. And so as we came, out of that initial phase of the pandemic, we got real serious about this in late 2020 and did some research. And actually, that allowed us a little bit of time to identify kind of, I would say, three primary areas that we were trying to solve. The first, and the one we heard about the most, was from our clinicians who are in the field, as we call it, like John was describing, who are not in the offices very often. They needed a protected, HIPAA-compliant way to talk with each other about patients on a regular basis. So that was one of the things we were trying to get at. The other, again, primarily around these clinicians in the field, was to provide a centralized, sometimes called repository, of where we could store common documents, common forms, things that they all use on a daily basis, and be able to access them easily. And there was another part to that, in that they're, of course, on mobile devices most of the time, phones, iPads, those kinds of things. And so it had to be something that they could access these documents in a mobile-friendly way. And then the other, which is kind of where we started, but we learned it was probably not the most important, but we wanted, was this enterprise-wide way of communicating, doing mass communication, both across the entire group, like Carrie mentioned, of 750 employees, and then each of the affiliates to have their own way of communicating across their organization in a mass way. And so those were the main issues or main concerns that we were trying to solve.
So now that we kind of understand how you got started and what you were looking to solve for, Carrie, maybe you could tell me a little bit about how it was implementing the tool, how this was perceived, what that looked like for you guys at Care Synergy.
Yeah, that's a great question, Jessica. So when we started implementing the tool, I like to put perspective around that question. We implemented in January of 2021. We were almost a year into the global pandemic that affected so many aspects of the world in various different ways. And so we realized very quickly that when we were launching Blink, we had to change our perspective about why and communicate the why are we doing this. And the why quickly solved for itself. You are now 7-8 months into a worldwide pandemic. We are more separated than we've ever have been, including our office-based folks who now are working from home. So now we had field staff that we rarely ever saw, because no one was in the office, and we had office staff who normally saw each other and shared a cupcake or coffee in the break room now no longer saw each other either. And so our communication channels broke down very significantly, and that was very apparent. And so when we got to launch Blink in 2021, it was very exciting. We raised awareness very quickly, and people started figuring out rather quickly through our demos that we were doing. We did a week long of demonstrations, the benefits that this could help with and solve for in our organization, how it can bring us together and bring our culture back together, even though we're still apart. And so that launching that, and when we launched it, actually worked to our benefit as an organization. When so many things were breaking down in our society, our organization was building up and recognizing and bringing to light our sore points.
That's amazing. Thank you. And so Care Synergy actually has an adoption rate of Blink of over 90%. So what do you think are the specific things that helped you get there and helped you achieve that?
Yeah, first and foremost, communication and spreading the word. We outlined Blink champions from the very beginning of our project team that were on site locally, grassroots kind of sort of people that could spread the word to people. Look at this great new app that IT just installed on my phone, right? And that was really helpful. That was really positive. But we got to a 90% adoption rate ultimately because our technology team, our IT team, pushed this app to our phone because we all in our workforce have company issued devices of some variety, whether that's a computer, a laptop, a cell phone, various different, whether it's an iOS or an Android device. We all get company issued devices. And so those, our IT department did a great job of installing the app directly on the phone, launching it. And then we did these lunch and learns or brown bag lunches where we got to encourage people to play around with the app. We did demonstrations, and that led us very quickly into our new hire onboarding experience that we do on orientation. So as I mentioned in my introduction, we do orientation every 2 weeks for a group of 15 to 20 people on average, And so we actually do on their second day of orientation, on their first day of orientation into the company, we actually bring out their phones. We project our phone onto a computer screen, and we actually walk them through how to make a feed post. We walk them through chatting with someone in the room. So we partner them up. They create chats. They play around with certain features such as sending gifts to each other, sending photos to each other. So different features in the app, all being HIPAA compliant and secure. And it really makes the atmosphere in the app seem fun, which it is fun. We just had a new hire group yesterday that we did this with, and everyone starts laughing in the room and having a good time and with expressions saying, "This is so cool. I wish I had this before." And it's just a fun experience for them. And so we get people to buy into the application very quickly on into their onboarding process, which goes to impact our culture.
That's so great. You're getting them hands-on from day one and taking advantage of the Blink fun factor that we see sometimes. So a little bit more about specifics. We're talking about how Blink is a super app that's helped Care Synergy. Speaking in terms of the hub itself, any specific items or things that you put in there that you think have really been impactful?
Yeah, another great question. Our hub really was trying to replace an intranet. We all had these network drives out there, and each of our organizations had their own network drive, and then we had a central drive, and it was very confusing. As a team member, I need to access this one training sheet. I need to access this one form. I have no idea where to go or even to start with. We put all of that onto Blink in the hub within a very quick time frame of implementation. We knew we wanted our EMR. We use an EMR system, electronic medical record system. We knew we wanted all of those training documents that people can have quick on-demand access to. We uploaded those very quickly. Things such as we took advantage of the feature called Quick Links. Quick Links allows you to put a document or a website application right on top of the hub page. And so on the top of the hub page, we put quick links to our payroll system, UKG. We put quick links to our learning management system, which is Relias. We put these hyperlinks, if you will, into the quick links into the hub so that people didn't have to remember a website now anymore, right? And so that was ultimately another benefit we got from Blink and implementing Blink was that hub feature and that quick access for things, as well as people in the field, not necessarily, if they didn't have access to the internet, they couldn't get into our network drives. They were basically, on out on an ocean without a proper flotation device. They're just swimming along, not knowing how to access things, right? And so Blink allowed us to give them that flotation device. It allowed us to give them the boat and give them the rows so that they could find and get the tools and resources that they need to do their job. And ultimately, their job is to care for patients and families.
Wonderful. And so for you guys at Care Synergy, in terms of what they're taking advantage of in the Blink app every day, it looks like chat happens to be the most used feature. Tell me a little bit about why you think that is and how you're finding your teams are using it today.
Yeah, our teams are using chats in a variety of different ways. And Evan, I think, is going to speak to some of those use cases around the chat. But chat, we start that off, like I said, at the very beginning of day one of orientation, where they get to create a chat with somebody else in the room that they wouldn't have otherwise known or met. Someone that's across the organization. So it could be someone working in Colorado Springs, which is 200 miles south of where our office in Fort Collins is. And so being able to create those connections, it allowed us to really see, chat allows us to really do collaboration and coordination, which is the cornerstones of our business. Without the chat feature, I would honestly say our culture would not be where it's at today with Blink. Chats is one of the most widely used features in our organization, and it's one of the most positive used features as well. We have things such as like a gratitude channel, which allows us to thank various team members. So when a family member writes in and says, you know what, Nurse Nancy was the best nurse that I could have possibly ever had, and thank you, I go on the gratitude channel when I receive those comments and I write to the whole team that Nancy is part of, including Nancy herself, right? And say, Nancy, look at this letter that you got from Jane, a family that you cared for, and how wonderful what a wonderful job you did caring for that family. And then the whole team gets to chime in and say, Nancy, great job, right? Because I can't bring Nancy a cupcake. She's not in the office, right? I can't bring her a coffee and say, thanks for caring for Jane and her family. I have to find a way to recognize that and have the team recognize that very quickly.
Thank you, Carrie. So yeah, talking about innovative and creative ways that Care Synergy is using this. Evan, I'll pass to you. Do you have any good examples of use case or specific new ways that Care Synergy is taking advantage of Blink?
Sure, you bet. And to build on some of the things that Carrie was talking about. So I think what we experience may be an example of that what you think might be the thing that folks tune into the most, or they use the most, or the main reason you're starting it may not always turn out to be that. And so, but Blink allowed for that flexibility. I, of course, being the communications guy, thought that, well, the folks are going to really, the feed will be the priority, and the fact that we can get information out to them. But we quickly learned, as Carrie was saying, that the chat feature became by far the most heavily used, and what our teams got most creative with. They actually drove some of these innovations of, as Carrie mentioned, creating the gratitude channel. And then being a network, an affiliation of providers, what that allows us to do is maybe one group will come up with an idea and then we share it across, and then they're all utilizing that feature, the best practice. And then, we wanted to solve, as I mentioned earlier, for that HIPAA compliant protected way to talk across these groups. We admit patients, both home health and hospice patients, quite a few on a daily basis. And someone came up with the idea of creating a channel chat for each one of these patients and then putting the members of that team on the chat. That was a huge hit. And so that's really why we see our chat numbers as high as they are, and folks utilizing that part of the tool to the fullest. The feed, wasn't unimportant. I don't mean to say that. It absolutely is. And so we wanted to think of ways to have it be most effective, and then, utilized to its fullest. So one of the innovative things we did, because what we saw was that sometimes messages that were posted would sometimes step on top of other messages. And so there are importance, obviously, in every organization to messages. For us, it was things like if we had IT things that weren't working and we needed to get messages out to folks immediately, or things about human resources, or even emergency messages sometimes about things going on in our area. And so we created what we call a content calendar of when we would like to see things posted throughout the week. It's not hard and fast, and if somebody posts outside of their content calendar day, they don't get admonished. But we have a day for human resources, and we have a day for education, like Carrie leads, and then we have times when we ask people not to post, because that's when it's likely that IT is posting critical information. And I think what that's done, it's make it more effective, but then it's also made it more predictable, and folks can anticipate when messages are coming out. They kind of know, oh, this is the day I'm likely to hear something from human resources about benefits, or there's an upcoming education seminar. And so I think it's both helped with the traffic and make things more effective, and then also helped our team members to anticipate and know and have some consistency of when messages are coming out. So those are some of the creative and innovative ways that we've used it.
Excellent. And Evan, Care Synergy clearly has had a lot of success with Blink. So in terms of measuring that success, what types of metrics and insights are you guys tracking to see, how you're doing and how impactful it's been?
Yeah. So, and John, why don't you help on this too? So every quarter we meet with our Blink representative. Ours is Maggie, and she provides us with a quarterly report of things. But the first thing we look at is what you touched on earlier with Carrie, is activation of accounts, and we have a very high level of that because of what they do in new employee orientation. We also are measuring the number of active users per day, and even created somewhat of a heat map around those. What that has allowed us to do is not only see that how the app is being used, but then it also helped us in targeting and building that content calendar around when we see people that are on the platform. This is when we want to target messages so that they're likely to see them and read them. So the number of active users is very important. For the things in the feed, the main things we track there are the open and then response rates. Our initial experience was our open rates were around 30 to 40%, which we wanted to improve on. We thought they should be better than that. So for the last year or so, we've had a improvement plan in place to get those above 50%. And the way we've gone about that is, I think we attended a webinar that Blink hosted about content, how to create attractive content to get people to read those. And then we also made an effort to make sure who was posting was the folks that our team members wanted to hear from. So we did an active campaign to try and get the presidents of our companies, again, human resources, IT, the folks that are important to our team members, and that has increased our numbers around open rates.
Yeah, and to add to what Evan's saying, Blink's done a great job in the last 18 months, maybe slightly longer, of providing visibility to admins into those analytics that will actually allow you to figure out what's hitting and what is not hitting, right?
Mhm.
So if we start to do something and we don't see a positive change in what the analytics are telling us, we can course correct and say, here's what we need to do. So again, that platform behind the scenes that not all the end users see, that allow us to measure that success, has really come a long way in the last 18 months.
All right, thank you, everyone. So now we have some time left. We'll go into some questions that have come in from the audience here. I'm going to start with another one for you, John. So when we look at this from an IT perspective, why was implementing Blink a priority, and how did you prioritize that, I guess, within IT?
Yeah, two main things come to mind with that question. The first is HIPAA compliance, right? Uh, with a field-based staff, they are going to find ways to communicate with one another and do it in the easiest way possible.
Mhm.
And before we had Blink, we knew there was texting, there was things going on. And by the way, our clinicians were great, right? They weren't openly violating HIPAA and sending lots of pertinent patient information. They would use initials and codes, etc. But that communication was going on. So we needed to basically say, hey, if we know this is happening, we've got to have a platform that enables it. And that was right up front with Blink. And then Carrie went into the other driving factor behind it, right? Which is document control, for lack of a better term, right? We had, whether it was on a shared drive or posted to old or to intranets, etc. When you're having a patient sign consent for treatment or a new notice of election, if you're not using the latest version of that, you have a potential to be missing out on revenue or seeing audit issues. We knew that if we created this centralized hub and drilled it into people that this is your location that you go to for this, all of the other sort of services that we IT provide would take a back seat to this as the primary location. So those were probably the two biggest drivers, was both that document management and control, and then making sure that we were providing our clinicians easy HIPAA compliant ways to communicate with one another. Evan talked about it a little bit. We didn't know it in the past, but it's really interesting for me to watch how a care team functions within Blink for a given patient, because that workflow improvement has been tremendous. And again, this was an unintended consequence, because all of a sudden you've got a group of people who are on a patient's care team. And when Carrie goes and visits a patient, she said, I saw that Mr. So-and-so was struggling a bit today. And Evan could then chime in, because he's on the care team as well, and say, well, I saw so-and-so at 6 p.m. and he was much improved. So that flow of communication about patients and workflow improvements was significant.
Jessica, can I add one thing as one of the driving factors as well? All of the things John was talking about, but we also had a leader, our CEO, who, brought this up. We didn't have to bring this to him. This was important to him, and so maybe what I'm commenting on is the leadership aspect of this, and how important it was for us to get something in place and be able to do all these things we've been talking about. I think without that leadership direction and leadership support, eventually we might have got there, but this only made it more important and a higher priority and moved it along quicker.
That's great. So it helped you create that. You were supported in creating that use case to be able to prioritize implementing Blink easily throughout the organization. That's great. Let's take another one here. Up for grabs by anyone. For other leaders who are considering Blink and an employee app like this, what advice would you give them, I guess, throughout any part of the based off of your experience?
I would first, as a leader, right, start understanding the why. Start getting buy-in early on from your end users very quickly. And I say that by asking them simple questions. How are you communicating with your other team members? What's challenging about that communication? Are you feeling like you're getting updates from your leadership team? Do you feel that the organization is transparent to your expectations? Right? Asking those probing questions, because we have a solution, and then you say, well, we have a solution that we're interested in that may solve for some of this. Would you be interested in exploring that with us? Mm-hmm. And those kind of things start getting buy-in from the people that are actually really going to be your champions for this app. And really helping you to understand what are they experiencing that's facing this challenge. And then they can help you build your why.
Excellent.
Jessica, one of the things that Carrie said resonates with me in terms of how you build that use case way back in one of her original answers, right? The pandemic really forced us to sort of see some more value that we weren't necessarily expecting. I do think, you look at where your organizations are struggling, and one of them right now, at least for us, is figuring out this new hybrid workforce. And so look at the challenges that a hybrid workforce brings for your organization, and figure out whether a centralized communication, and we haven't gone into the details of it, but the ease at which you can have a one-on-one conversation versus a team conversation versus an entire organization conversation with, just it's almost out of the box configuration, has made that communication and making sure people stay connected to those in their chain and for healthcare in their field, just phenomenal.
Great. All right, next one, a little bit more of a technical question. In terms of what the experience is like through the hub. So Carrie, you were talking a little bit about those quick links before that you guys look to implement. So when an employee goes to click on one of those, what is that experience like? Are they automatically signing into that? Are they having to send it to each one individually? How did you guys set that up?
We decided to take advantage of single sign-on whenever we could. That includes Blink, that includes a lot of our other ancillary applications. The answer to the question is a little bit more difficult, though, because it depends on whether or not you're on the mobile platform, which is not authenticated to our network and therefore won't allow you to take a single sign-on credential through Azure or LDAP or something like that. So for those of us that sit in an office all day, the quick links work out great without additional sign-in. But if you're sitting in your car waiting to go to the next visit and you're using the link off of your mobile device, since it doesn't already possess those credentials that you would need to make single sign-on work, you have to go in and sign in individually for the app. So it works great from a laptop. You're sitting on a network, less ease on those quick links for those applications that you're using mobily. Carrie, do you agree with that?
Yes.
All right, next one is, I guess, combating potential pushback. So do you guys see any downsides to giving a quote unquote like employee communication type of application to your workers during the workday?
Yeah.
Did you get that feedback at all from leadership?
So I think initially the pushback came primarily from employees. And what I heard the most was, they're giving us yet another thing that I have to check each day. I already had email. I already had my payroll system. Now it's just another thing. And I think that's where, as John was saying, trying to combine as many things into the one app has helped with that. I think also developing the things that made it more valuable or made it most valuable, like these things we've talked about with the channel chats and things of that nature, have kind of resolved that with the frontline employees. With the managers and leaderships, we'll say for the most part, everyone was on board because it's in many ways made their role easier in order to communicate with folks. However, we did have some not so eager adopters, I guess I'll say. And so as a work group team, we did have to engage with those leaders and talk with them directly and show them the benefits of what this could bring, and also listen to them about, well, what can we do differently, or what can we add or change that will make this something of value for you to use with your team. And I think for the most part, that's been adopted now as well.
The other thing that I would add to Evan from an administration standpoint is the Blink. So yeah, there are some downsides of employees on a communication app during the day, but Blink makes it pretty easy to figure out who can build content and post content to any given feed. So not everybody is able to send a note. Let's say you've got a disgruntled employee and they want to send a note to everybody about how bad their day is going. That's not possible on the feed. And it's not possible in some of the larger chat, they're called channel chats that Blink uses. That one-on-one communication, I'm having a bad day and I think that my boss is being mean to me and I'm going to tell Evan about it. That communication is going to go on anyway. Yeah, we may have made the communication a little bit easier and sort of built it into the workflow. But if I'm mad enough, I'm going to pick up the phone and call Evan or find some other way to communicate to him. But it was a hurdle that we had to get over with our leadership. And it really was that understanding and being able to control who can post to what that got people comfortable with sort of that potential downside.
Is that something that, as you've been utilizing Blink and seeing how people use it, that you've been modifying at all? Have you been creating new types of teams or opening that up or closing that off at any points in time?
We've definitely been creating new types of teams. And some of that is easy to do with a channel chat. Some of it is, you got to go in and type in 35 different names. But one of the things that Evan touched on briefly, but I'll add to it. The reason we've been adding more teams is because people are finding that instant gratification, instant knowledge really useful, right? So I'll use my own team as an example. When we were transitioning the first level of support for our electronic medical record into our tier 1 technical support team, they created an EMR help chat. And anytime a question came in, they put it out and whoever was sitting at their computer could say, oh yeah, you do it this way, or you do it that way. And I know that happens amongst new employees or, the Southwest team. That ability to get instant access is causing us to create sort of more different dimensional or more dimensional teams that allow that ease of communication. The control is pretty simple in terms of you're an admin and you can post, or you're not an admin and you can't post. Yeah. So we haven't made too many changes to that, who was admins.
And I just have one more question really around the implementation. Maybe you could tell me, so we talked a little about the pain points and how you kick this off and how you're getting adoption from day one, but a little bit about what the process was like from you guys setting this up and getting it up and running and kicking it and working with Blink to do that.
I guess I can speak somewhat to that, because I would encourage, one of the things we formed immediately to help us just keep track of things and move it forward. We had a Blink work group within the organization that was made up of key stakeholders, myself, there was a representative from IT, Carrie and her team on education. And then we had a representative from each of our affiliates, is how we're divided up, so that they could bring things to that group. We utilized them. It was kind of like the evolution of what Carrie talked about with the Blink champions.
Yeah.
Once we had it and we had it in place, then we were trying to more normalize its implementation, and we did a lot of that through this Blink work group. And so I would encourage folks to consider putting together a group like that. We didn't call it a committee; it truly was a work group, and we worked on real issues, constantly, updating and doing different things. So I think that's one way to continue the success.
Great.
And the other thing that I would add is we had a very short time frame. I think when we originally started the implementation, I want to say 2 months. I'm going off the top of my head to when we wanted to be live, because we wanted to be live around January 1st, like every other application ever always goes live on January 1st. But the Blink implementation team brought a very structured implementation to us, and we didn't know how to implement a software like this before, because we hadn't done something like this before. So it was a very structured implementation, and the steps were able to get through completely. And I do think Carrie has done a great job. What we find with lots of applications that we implement is the implementation goes well, but then the first new hire that comes on after the implementation training is over doesn't have the same level of knowledge, and then it just gets worse and worse and worse as you get farther and farther away from implementation. But what Carrie was talking about earlier about integrating that into new hire orientation and making sure we don't lose that skill set and make it a critical tool from day one of employment is critical, because again, in healthcare, turnover's high, and so the number of folks that any organization will have a year or 2 years after implementation that went through the implementation is limited.
All right, I think we've gotten through all the questions from the audience now. If there aren't any final thoughts from your side, I would just like to thank everyone for joining today, and mostly thank the Care Synergy team for taking the time to speak with us. John, Evan, Carrie, thank you so much for being available for the discussion today and all of your insights. And thanks again, everyone. Have a great rest of the day.
Thank you.
Thanks.